get me out of here. You can't stop me from...
I can't stop you, that's true.
That's what I want to do now, stop it. Please.
Thousands of people have died in care homes in just a matter of weeks.
I knew that I'd promised John that I wouldn't leave him on his own and that I'd be there for him, and I couldn't.
As the government prepared to save the NHS, did they sacrifice care?
We're getting told that every staff member in healthcare and every resident, regardless whether they've got symptoms or not, will be tested. It's a lie.
Northfield Care Home is one of 3 specialist nursing homes owned and operated by Palms Row Healthcare. Filmed over 6 months, we witness the events leading up to this crisis and see for ourselves what it was like at the peak.
He was fighting for his breath. He was fighting, he couldn't breathe. It were awful.
A lot of beds in this care home are set aside for the NHS to use. If hospitals get busy, during the winter flu season for example, then hospitals rely on these beds to relieve pressure on wards.
We really are an extension of the hospital locally.
In the next few months, these beds will be in high demand in a way no one could have predicted.
It just come out of nowhere really. It spread so vastly and very, very quickly.
When coronavirus arrives in the UK, care homes are given this government advice.
There is no need to do anything differently in any care setting at present. It is therefore very unlikely that anyone receiving care in a care home or in the community will become infected.
That guidance remains in place until March the 13th, but by then the number of confirmed COVID-19 cases has already risen to 798. Care providers have told me that during this time, staff absence levels went through the roof. Some people had symptoms and were self-isolating. Others, I'm told, were scared stiff to come into work. It's good to see. Lisa Flynn's mum was a senior carer and a housekeeper in a care home.
Some of the staff that were showing symptoms or had family members showing symptoms, so weren't able to come in. So my mum was the first one there to offer her help. And when we asked her not to go, she said if everyone had that attitude, who would go and look after those people? She's got 5 grandchildren. She always wanted to be with them. She was a real party animal and loved being with people. Sorry. I think it was about the Tuesday, she said she'd got a scratchy throat. We didn't think anything of it because at the time it wasn't one of the symptoms. And she was laughing and joking, going, but I feel absolutely fine. I think it was about 6:30 in the morning on the Saturday. I got a call on my mobile and it was my dad saying, I've had to call an ambulance, Mum's not well. And in the background, she shouted, tell her I love her. That's the last I've got of my mum. Next thing, I get a call and it was my dad screaming down the phone to me, saying she's gone, she's gone. Within minutes, she'd closed her eyes and her lips were going blue, so he rang them back and they were talking him through the CPR on the phone and it was too late. They tried and there was nothing they could do.
We can move staff around. We're able to move staff around. As tonight, as you can see, we've only got 3 on tonight. We are going to need another extra one for tonight.
Staffing levels are desperately low, partly due to self-isolating workers. And demand for personal protective equipment, or PPE, and antibacterial cleaning products to kill the virus have skyrocketed and supplies are running low. New government guidance is published on April the 2nd. Care homes are to play a big part in protecting the NHS from being overwhelmed. They will provide beds so that the elderly can be discharged from hospital, with test results so that the home knows if they have COVID or not. Care homes are now a critical part of the plan.
With no testing, people were obviously terrified. So they were staying at home. Again, that put further pressure on our system.
Concerns start to grow. Many social care workers begin to struggle to access tests which would clarify whether they had the disease or not. And care providers have told us that they begin to receive discharges from hospital without the promised COVID-19 test. To make matters worse, there are signs that PPE supplies are being diverted to the NHS, as these emails to care providers make clear.
From Monday, they cannot sell gloves, face masks or hand sanitizer to anyone apart from the NHS.
Staff were panicking, staff were worried. We've never ever been in this situation.
I don't think any of us were prepared for what we were dealing with, and it just, it just felt a lonely place to be.
The Department for Health and Social Care told us their supplies of PPE were designed to accommodate delivery to NHS trusts. That was eventually widened to include care homes and other settings, but only until after April the 6th. A spokesman said at no point were suppliers asked to prioritise the NHS over care homes. Coronavirus has ripped through these wards with frightening pace, and they're dying here. In one room is a man called John Allison. He's struggling to breathe, but they're trying to make him comfortable. It's obvious he's not, and he is deteriorating fast.
John was a kind and caring, loving gentleman. It was lots of fun. He used to love walking round this park with his wife, and they walked round here most days. It was his favourite place to come. He'd been in hospital and lost the use of his legs, so they discharged him for rehabilitation because John lives in a first floor flat. So they says we'll send him into the care home, can stop there for a couple of weeks to build his strength up, have a bit of physio, and at the same time he developed COVID-19.
It's definitely not eating.
I think sometimes this isolation gets to him more than the COVID. Because they're all missing their families and all they see is masks.
Get me out of here. You can't stop me.
I can't stop you, that's true.
That's what I want to do now. Stop it. Please.
It's just heartbreaking not being there with him, not being there when he took his final breaths.
I still can't describe it, from him being absolutely fine to dying.
The only thing that we could do is sit there, be there to end.
It's hard to sit with somebody knowing that you're not their family, but you've got to try and act like their family just so they could know that somebody was with him.
How can you shield a nation of the vulnerable if you're not going to shield the most